Okay, Lori. Tell me a little bit about what's going on now. What hurts the most right now? Your foot? Your hip? What?
Actually, nothing hurts right now because I have the placebo effect. But
okay.
if I take my shoe off or if I'm asleep,
can you stand on your foot right now, barefoot, and you feel plantar fasciitis pain?
Yes.
Okay, why don't we just do that so I can demonstrate how this works?
All right. And what's strange is the top of the foot feels like it's broken.
Okay.
Because it's the...
It works through your clothing, so you don't have to put your...
Oh, I don't need my sock
Yeah,
off.
you can leave it on. It doesn't matter. Okay. So where do you feel pain right now when you stand up on it?
The top of my foot.
Okay.
Which I think that from the tendon pulls from here.
Can you pinpoint right where you feel that? Okay, so you feel it on the back of the calf too?
All the way down, and I think that's what affects the...
So the worst
right
point
here.
of pain is right there or on the back of the calf?
Should have not taken pain medicine is what I shouldn't have done.
It's okay, you're fine.
Because I don't feel it as bad right now. But
Can you pinpoint and push into it and go, oh, that hurts if I push here?
So I guess that's
tender.
That's very, very tender there.
And when you push into it, what does the pain level go up to? 10 is the worst, 1's great.
I would say about an 8 right now.
So I'm going to put this right where you push your thumb in, okay?
Okay.
So,
Is it going to help the tight muscle?
we'll find out. Let's
Alright.
do that. Move your finger. Okay, now I want you to push into the patch and tell me if it's still an 8. Better, same, worse.
Always feels good when I rub on it. So inconclusive. I can't tell. I'm sorry.
Can't tell. No, it's still an 8? Okay, so I'm going to try some different ones. Okay, don't worry. I'm going to take it off. And I'm going to experiment. And one of these, I should get some...
Should we do the top of the foot, maybe?
Oh, does that one hurt too?
Yeah.
Okay,
We'll just do
show me right where you feel it on top of your foot.
Probably right there.
Okay, so what is it when you pushed on it, and now what is it when you push on it? So I need a before and after.
Probably about a 7 before I put it on.
And what do you feel now?
Warm.
Warm. Okay, what's the pain level though?
Well, when I'm pushing on it, I'm not really feeling any pain right now when I push on it.
And you were at a 7.
Yeah.
Okay, that's the new stem cell patch. That's what's pretty cool, how that thing works.
Okay.
Alright, so just for the heck of it, stand up on it and see what you notice in your calf. Does your calf get any better, or is it still the same?
I don't feel anything in the calf right now.
And normally you would, right?
Yeah.
Huh?
I normally would.
Okay, so that's a good sign. Cool. So
when
what?
I come back, I'm not going to take Tylenol.
Okay, no, that's okay. You're fine. So what's your pain level in your foot now? It was a 7, went to 0 when you put the patch on. Now you're walking on
Now
it.
that I'm walking, it's...
Normally it would be painful.
Yeah, normally it's a real nuisance.
And what is it now?
Well, it doesn't hurt on the top of the foot at all.
That's cool. How's the calf?
So and the calf's not hurting.
That's awesome.
So just on the bottom of the foot. But,
And what's the pain on the bottom of the foot?
maybe a 6 on the bottom, like where the whole heel and
Why
where
don't
the
you take the
tendons
patch
all-
off the top of your foot and put it on the bottom and retest it.
Okay.
This is how I teach patients to do this themselves as homework.
So what is the patch?
I'll explain, but
Alright.
just test it first, yeah. It's really cool. There's no chemical, there's no drug, it's non-transdermal. And what happened to the pain in your arch?
That's kind of freaky.
Why? What happened?
That's weird.
What happened?
Yeah, I
Is it-
don't feel any pain in the center of my foot. Now I'm
And
gonna
what
try
was
it
the
on
pain in
heel.
the center of your foot?
Yeah, like it.
What was the pain in
Yeah,
the
it
center
was
of
like
your
a
foot?
5 or 6 there, and I'm gonna put it on my heel now.
Okay.
That's weird.
No, it's exciting. There's no accident why you came in here, right?
No, not that. Not right now.
And what happened?
Like the top of my foot wants it back on there.
Okay, so that's okay.
The
Now
top
it
of
works
the foot's hurting.
systemically.
Yeah.
So no matter where you put it, but we're trying to find the worst spot that gives you the best relief for the whole
Yeah.
foot.
So I'm not sure. What I don't know is where is the pain coming from? Like,
Well,
you know, I feel it in my foot.
Yeah.
Can it be coming from somewhere else? Like,
Here's what's
down
weird.
all
The
this.
body is like one piece.
Yeah.
And the patch turns on your own stem cells to become very healthy and young, like a 20-year-old, for instance. Now it's going and it's attracted to where there's inflammation. Wherever there's inflammation, it's going to start healing.
Okay.
So it doesn't matter where. We're just
Okay.
trying to help you get comfortable to then allow the healing process to begin, and it turns on immediately when you put the patch on.
Okay.
And that's how this stuff works.
That'd probably be the easiest place to put it, I think. On
Yeah.
the top.
Right there. Okay. And as it's on longer, it gets better.
Okay.
Pretty cool.
That's weird. Okay. All right.
All right.